Basically, when coronary artery blocks, before the blocking process starts, there may be some symptoms.
Yes.
Patient may acknowledge it or not, but symptoms are there. So, what are the symptoms and risk factor involved before the coronary artery fully blocked?
Yeah, it is a very important question. Everybody in the public should know what are the symptoms of the coronary artery block and when they have to report to the hospital and particularly to the Department of Cardiologist. The main very important symptoms with which the coronary artery disease manifests is the pain in the chest, what we call in the medical language angina. So there will be
Angina.
yes, there will be a retrosternal, that is the pain behind the chest bone. There will be there, and it will be little burning type, sometimes very cruciating type of pain, and that pain sometimes it will radiate to the upper part into the neck, jaw, head, and towards the side of the arms. So this type of pain, if it is there, then anybody getting such type of pain, they should report and get a thorough checkup by a cardiologist. We should not ignore this one. Second point is sometimes they will get breathlessness even at rest or with short walking or short climb in the stairs, and sometimes after taking a heavy meals, what we call as postprandial angina. This is sometimes very important. Many patients, they will tell that after taking food, I am getting pain.
Yes.
And unfortunately, they confuse this with gastritis. They will take some gastric medicines and all. They forget the cardiac issue. That's how sometimes the disease becomes more severe. So if this type of situation comes, then they should immediately consult to the doctor and do a thorough checkup. Sometimes it may not be because of cardiac, what we call the atypical chest pain, but still we advise they should come and get a thorough checkup, because if gastric pain, if it is ignored for some time, does not make a serious problem. But if cardiac pain, if ignored, sometimes it can cost the life of the patient.
Yes, yes. Yes, though it's a heart-related issues, patients should go and check thoroughly. And do you recommend any every year they should go for a regular checkup in every year or every 6 months?
Yeah, the standard guideline or what we make a protocol that anybody crosses the age of 40, they should have a routine checkups, not like hundreds of tests. People come with going various diagnostic places. At least they should check whether they have a blood pressure normal or not, whether their sugars is under control or not, whether they have any thyroid abnormality or not, and whether their lipid profile, whether that is within normal or not. These are the routine tests, they should get it. And if they are not symptomatic, if they don't have this type of symptoms like breathing difficulty or angina, they need not go for a intra-invasive checkups. But these are the checkups they should routinely have. And if possible, have a baseline ECG, which can be compared when if they develop any symptoms later. So once they do at 40 years, if there are some companies they do their staff every yearly, but the public, if they are not symptomatic, it may not require every yearly, but once a while, maybe 2-3 years, or if they have some discomfort or anything, they should have a checkup.
So, do you recommend every yearly once or yearly twice?
No. If there is no abnormality, I think is a mass public, they can go for at least 2-3 years onwards. Every year also not required. But if they have any of these risk factors, whether blood pressure, high or diabetes, thyroid profile abnormality, lipid profile abnormality, any abnormal ECG, they should undergo at least every year to know that their heart is all right.
Okay.